Carpal tunnel syndrome is one of the most common diagnoses within all of orthopedic surgery. Carpal tunnel syndrome is defined by compression of the median nerve at the level of the wrist. The carpal tunnel is an actual tunnel at the base of the palm, made up on the bottom of the small bones in the wrist in combination with the transverse carpal ligament. Passing through this tunnel are the tendons that are responsible for the flexion of your thumb and your fingers. Also traveling with these tendons through the carpal tunnel is the median nerve. Compression of the median nerve within the carpal tunnel is what gives rise to carpal tunnel syndrome. Carpal tunnel syndrome is classically described as numbness and tingling to the thumb, index, and middle fingers, though it is well established that oftentimes patients will report numbness to all of their fingers and also may experience pain up their forearm and occasionally even all the way up to the level of the shoulder. It's very common that people are bothered while holding a book or an iPad for a prolonged period of time. Numbness and tingling in the hand can also occur after driving for a long distance. Waking up from sleeping with numbness and tingling in those fingers is another very common complaint of carpal tunnel syndrome, and perhaps the most aggravating. Frequently, people will report they hang their arm off the side of the bed or they shake their hand out to get the numbness to go away. The effective treatment for carpal tunnel syndrome really comes down to three options. First, wearing a night splint that holds the wrist in the optimal position prevents compression of the median nerve, thereby preventing numbness into the fingers and helps you to get a better night's sleep. A second option for conservative treatment of carpal tunnel is receiving a cortisone injection into the wrist. This helps to confirm the diagnosis of carpal tunnel syndrome and can provide patients with months of relief from their symptoms. The third option for carpal tunnel syndrome is surgical decompression of the median nerve through a carpal tunnel release. This is a small surgery that I describe in more detail in another video in which we review the options for surgical treatment, the post-operative recovery, and details of the surgery itself.